My name is Barbara Hayner. I'm a family certified nurse practitioner. I currently work as the clinical coordinator for the Providence Intervention Center for Assault and Abuse, and we're located up in the Everett, Washington area. I've been doing this for approximately 36 years. And we see on an average of about 1,500 medical patients a year through our center. We have a team of forensic nurses that respond to 4 emergency departments in Snohomish County. We also have a clinic where we have scheduled examinations. And we also provide medical services to Skagit County, Island County, San Juan County, and on call as they need it, Whatcom County. I'm going to talk to you today about being successful in a medical setting, and specifically we're going to talk about an emergency department, and we're going to talk about post-pubescent patients or victims of sexual assault. And you'll hear me primarily refer to them as patients. Every discipline has their own label, name, title that they utilize. The objectives today is I would like you to have a increased knowledge of how to be successful in an emergency room, to understand the victim rights that are available to them within a medical setting, and just so you know, most of these victims' rights are also applicable to law enforcement proceedings. So most of the time, if you're thinking that it's something that they're allowed to have medically, it's also something that they're allowed to have within an investigational setting. We're going to identify the basic components of a postpubescent, and it's very important that for the purpose of medical assessments that you clearly understand the difference between a prepubescent, meaning a child or teenager who has not yet gone through puberty, and postpubescent, which may be a teenager or an adult that has gone through puberty. Right now in the United States, the average age of entry into puberty for a female is 9.5 years of age. A male is 10 years of age. So you may have a very, very young child who is fully pubescent and has to have a different type of exam that maybe you've seen with younger children before. And that may cause confusion, and certainly feel free to talk to the nurse about why it's different with this particular patient. And then finally, I hope to give you some strategies to help guide the patient and yourself through an emergency department interaction in a way that benefits the patient, does not traumatize you or the patient, and allows for appropriate care. Now, one of the things that's really important that we're actually quite proud of here in Washington State is the long battle that we've had in order to develop statutory rights for victims. Important in a medical setting is that, first and foremost, access to medical care cannot be impeded by law enforcement or other investigational activities. So if, say, you had been called out, possibly through your crisis line, to go to a police station, and you are with a patient or a victim, and you feel that they need medical care, yet they're going to do a multi-hour investigation and interview, that law allows for you to say, you know what, I think she needs to go to an emergency room. We can call the nurse on call, and we can verify with her if this is something that can wait or not wait. So the investigation cannot impede access to medical care. Secondly, the communication between an advocate and their patient or victim client is privileged under that RCW. And it has a few caveats to it. This is only if your communication is one-on-one with the victim. If there is a third party in the room, anything that happens, that is not considered privileged information, and you could be asked to depose to that or be subpoenaed. However, again, any one-on-one communication is privileged by law. The third one is that you have, or the patient has a right to a personal representative and or a specially trained advocate if they so desire. And I would say that that is probably one of the most common areas that is overlooked on the part of medical. And it's one of the areas that I really urge advocates to be in and developing relationships with their medical providers in the area so that they're automatically called within the scope of HIPAA and other confidentiality issues. So when we look at the service standard for medical advocacy, the activities are such that you're going to assist in making informed decisions, including referral for the forensic exams. And the purpose of being trained in this is so that you have that information to be able to say, yes, I know that it happened 3 months ago, but this is a reason why you may want to go and get a forensic exam, and this is where you would go to get it. So that's important. It's not just that we're within an investigational level, but there are real reasons that we'll discuss in just a moment as to why exams or assessments are really recommended regardless of time frame. You're going to provide information about medical care and what concerns that may come up. You're going to act as a liaison between the medical provider or the nurse, most commonly in Washington State. You're going to, if you are doing medical advocacy and your particular organization supports it in a face-to-face manner, you're going to be in the emergency room. And I would urge you that if you have any concerns about being in an emergency room, even if it doesn't involve your particular client, you're going to be exposed to bad things happening to people. And you need